We're here today just going over some of the equipment and activities that the TAP program, the Technical Assistance Program, uses when they're out in child care centers. And these are things that we use to fully include children in the center so that they can be active and participate in all the activities. Some of the things we use are fidget toys that a child can use in circle time so that he's not fidgeting with somebody else's hair or somebody's leg or getting up too close to a child. He can just be fidgeting with some of these things. For kids with behavior issues, we can use some of the stories that we create. Like, I can use my words, and it talks about a child teaching him how to have a turn. You know, you took my book, I want your book. And very often using visuals with the kids can help them. We have schedule boards that will give a child's daily schedule so that the child knows what comes next and knows what to expect. It can solve a lot of behavior problems. So there's like breakfast, circle time, singing, painting, toileting, the book, on up to nap time. Then we have some specific visuals we use. This one is for hand washing, that the child can turn on the water, get the soap, wash his hands, turn off the water, and dry his hands. So taking that child step by step with a visual kind of implants that in the child's head and enables him to do it a lot more. For kids with fine motor issues, we can take buttons and put those into Play-Doh so that the child has to find the buttons, which is a good fine motor activity. As far as large motor activities, I'm going to let Terry talk a little bit about those.
Okay, so we also have an equipment lending library so that our child care providers don't have to purchase large pieces of equipment but can borrow them and then return them when they're finished using them or when the child has outgrown them. This one in particular is a corner seat that will allow a small child who cannot sit up on their own to have support in the back and the head, and then have a table space for them to do the activity with the other children or while they're sitting in their seat. It's on casters so that the child care provider doesn't have to constantly bend, pick up a heavy child and move them across the floor, but can gently push the piece of equipment across the room so that the child can be included with the group of children in the classroom. This is another example of a piece of equipment that we loan frequently. It's a feeder seat, and it allows a child to be in a seated position when they're eating so that their needs are met. Some children can't quite sit up in a chair, but they need a little bit of support. They need to tilt back a little bit. And with the permission of their OT or their PT, we would bring a seat like this to the center so it can be used for the children to have lunch, have meals, have snacks with the other children in their group.